Hi, this is Jessica DaMassa with WTF Health. I'm here with Burt Rosen. He is the Chief Marketing Officer for HealthSparq, which is the company that puts on What's the Fix? Also, WTF. It's a startling coincidence. We're so happy to run into each other at morning yoga here at Health. Yeah. So Burt, nice to meet you. Great to talk to you. So tell me a little bit about What's the Fix and why it's so different than any other conference in healthcare.
Sure. So we put on What's the Fix because I've been going to healthcare conferences for 4 years. I've only been in healthcare for 4 years and got to the point
You're bored already.
I was so bored. Got to the point that it was so tired of the echo chamber, right? Like all the same people talking to the same people about changing the stuff those people created. And we noticed that there was a distinct lack of people voice in the room. So we said, what if we flipped the conference model and had real people talk about healthcare obstacles that they'd overcome despite the system, not because of it, and driven change as a result. And that's the basic premise.
It's a patient conference, really. I mean, you have a lot of patients that are speaking about their experience.
Patients, caregivers, people involved, normal human beings.
Okay.
Right? Like, I prefer not even to label them. I just call them people.
They're just people.
Because aren't we all?
Well,
just people? Yeah.
Yes, we are.
Yeah.
We are. So the other thing, too, I think that's different about it is that you're broadcasting everything live, right? So tell me about that.
So you asked also what's different. So we don't charge anyone to attend. We have a great partnership with the Design Institute for Health at Dell Medical School, which is part of University of Texas, Austin. And we stream all of it live, and we focus as much on the online experience as we do in the in-room experience. Cool. And like I said, we don't charge people because we actually want people to learn from people and go make change based on what they hear. So.
I know this event is held in May usually, right?
Yeah.
So, but I'm curious, like from your experience, I guess, doing this last year and this year, what kinds of things are people talking about at a healthcare conference, and how is it different than what industry folks are talking about in healthcare conferences?
Sure. And just tell me to stop when you want me to stop talking.
Okay.
So industry people will talk to you about the things that they've come up with, about how they're going to solve people's problems, but they won't actually have people who are saying, these are my problems that I need you to solve, right? So there's so many companies that come up with answers to questions nobody's asked.
Okay.
So that's one thing. I'll give you a quick example. And so one of the things that came up a lot, I take feedback very seriously, and the goal for What's the Fix is to be very organic. And I actually have a guiding principle for myself that if it feels like a healthcare conference, I failed, because we want it to be very different. And we had a comment last year about the food we served, and then we talked a lot about nutrition, and we got a question online about nutrition. And this year, we're working with a caterer that we're not treating as a vendor, but we're treating as a partner, and we're actually treating our catering as content. So, for example, we're serving only healthy food. We're working on recipe cards for the food that we're serving that we can distribute through social and in the room. And the part that I'm most excited about is we're going to have an estimated time to prepare on the recipe cards and an estimated cost per meal. So for example, we're going to be serving a grain bowl for lunch. And I think we looked at the cost per meal, and I think for 4 people with shrimp, which is probably the most expensive, it was $7.80. Right? So when you break that down, it's like under $2 a person to eat healthy, full grains, like with protein. And so that's one of the things I'm really excited about. And that's nutrition is something that personally I believe needs to be discussed a lot more.
Do you feel like that regular people at a conference are talking about, like here we are, like I'm innovation conference, right? And it's like we're talking about like what's coming next, what's the future. Do you feel like regular people are as concerned about that, or do you think that they're more concerned about what's happening right now and how broken the system is?
So we're talking about the future at the conferences. People feel like the system sucks and I don't want to deal with it. Okay. So I think getting up and talking about, I won't single anything out, but getting up and talking about some answer that sounds amazing 3 years out, like interoperability or whatever else it might be, right? At the end of the day, like I'm a patient, right? Like I'm a patient who goes to, we're all patients, and I go to multiple doctors and naturopaths and specialists, and I carry around a binder of all my tests because I can't get it all online, right? So I don't really care what the industry calls it. Like I just want that need met.
Yes.
So I think if you ask most people about healthcare, they would tell you they hate it. They'll give you the reasons that they hate it. Like those are the things that need to get fixed in my mind.
Do you think that they're excited about the same things that we're excited about when you're coming into an industry conference? Like, are they excited about this like bright, sparkling future where things do talk to each other and there's no more fax machines and things like that, or do they not care?
I don't think they care. I think we're all consumers, right? Yeah. So not even healthcare consumers, just in general consumers. Yeah. So I'm not going to buy something. Maybe I'm different than other people, but I'm not going to buy something because of all the back-end technology that goes into creating it. I'm going to go buy something because it meets a need I have. Right? So I'm going to go buy a shirt because I like the shirt. I don't really care if it's robotics or where the manufacturer, right? Like I don't care. I need a shirt.
Okay.
So,
fair enough.
So I think one of the things that I wish happened more at healthcare conferences, and some are starting to, but they should all have patient scholarships. They should all have patients in the room. So, I'm pretty passionate on that one.
Well, good.
And that's why we did What's the Fix. So.
No, I think that that's incredible. And so we've been asking everybody WTF Health, but meaning what we mean by WTF Health, which is what's the future?
Right.
So what do you think the future is for conferences? I think you kind of alluded to it. You're hoping for more patients included, but I mean, as far as the healthcare conference, do you think there's going to be some innovation in this space?
I just have to make sure I'm not going to get myself in trouble.
Okay.
Honestly, I think the innovation is going to come from outside of the space.
Okay.
So whatever Apple does, whatever Google does, I mean, even Uber is driving innovation in healthcare and not a healthcare company traditionally.
Yeah.
So I think we'll see innovation come from those places, and I think the industry is going to have to react to it. It's honestly, it's hard for me to see true, like, people's needs being met with the industry talking to itself about how to do it best. So one of the things I'm dying to have happen is if some CEO of a major payer leaves, like, I'd love to see them hire the CEO of Nordstrom's, understanding that healthcare is like a complete, right, because healthcare is a customer service business, right? So I think that can drive change. So I think it's either going to be that or I think it's going to be outside companies who push.
All right, well, we'll see. So thank you so much for joining me. It was a pleasure to talk to you. I'd love to meet another WTF Health. Yes. And for that, anybody who wants to check out the conference and learn more about it, where do they go?
What's the fix.info.
There you go. You heard it here. This is Jessica DaMassa with WTF Health.